Hi everyone, I'm Elyssa. Welcome to the next session of Before and Beyond. I'll be taking you through one of the root canal cases that I've seen, and we'll do some treatment planning for this session. So this is a 68-year-old Chinese male. He's fit and healthy, no known medical history, no known drug allergies. He comes in complaining with a gum swelling on his upper right region, and he brings along this OPG that was taken months ago. He says that the gum swelling on his upper right has been ongoing for the past couple of weeks. It hurts him every now and then, especially when he chews, and sometimes it causes him sleepless nights because of the toothache over there. So here on the OPG, we can see that there's quite a lot of work done on his upper right region in this area here. We can see root canal treatment has been performed, implants, crowns, and also if we look at the opposing dentition, root canal treatment has been done for the forceps and crowns as well. So we proceeded to perform a clinical examination for him to make sure everything was okay on quadrant 1 and quadrant 4. So after examination, it seems that quadrant 4 is cleared, no problem seen at all. It has no infection, no tenderness, no pain, and the source of pain was from the upper right region as what he has described. So we advised him to take an updated periapical x-ray to zoom in this region. So here we can see that 1-4, root canal treatment has been completed since the previous x-ray was taken. A crown has been done as well. 1-5 has an implant placed, and 1-6 and 1-7 has crowns. And 1-6 also had a history of root canal treatment done with silver points, which are these needle-like structures. And 1-7 has some root canal, has some infections over there, which is a periapical radiolucency, highly suggestive for some root canal infection over there. This also corresponds to what we see clinically, where we get a deep probing depth in that area, around 10 mm, narrow in origin, seeming to be as if it's a draining sinus tract from this tooth. 1-7 also tested not vital. And out of the whole lot, 1-7 was the most tender to percussion, while 1-6 was just slightly tender to percussion. So for this treatment plan, what we did was we prioritized based on the patient's pain and knowing what was more urgent compared to everything else. It was going to be the 1-7. So I advised the patient that 1-7 required root canal treatment. We're going to keep the crown intact because the margins are great. There's no defective margins. We are going to drill a small hole through the excess cavity, gain access to the root canal system, do some disinfection, some cleaning, seal it up with some dressing, and see how he goes from there onwards. If he feels much better next session, we'll finish up with the obturation for 1-7, and that's it. Then thereafter, we move on to seeing 1-6. 1-6 has some is slightly tender to percussion. I'm not sure whether it's because there's some minor infection from that tooth or whether it's due to referred pain from 1-7. Because 1-6, although the root canal treatment isn't done to satisfactory quality, it reflects quite poor cleaning and shaping done. If the patient is not having much pain, an option is certainly to just leave and monitor it for the time being. So this was discussed with the patient. If 1-6 still presents with some tenderness to percussion, we can do the retreatment and retrieve all the silver points by drilling a hole through the crown and disinfecting it. And at the same time, we can also look for a missing MB2 if there is. However, on the other hand, if after treatment of 1-7, 1-6 tends to be asymptomatic, an option is also given to monitor. So if the patient were to come back to see me for his routine root canal reviews every 6 months or annually, we can take x-rays and at the same time 1-6 will be captured. If it's asymptomatic and the PA lesion is not worsening in size, we can of course monitor it without further treatment. But at any point in time, if there's clinical signs and symptoms like it's still tender, or if let's say the PA lesions are worsening on these roots, for sure we can go in to retreat this tooth. So this is how we treatment plan for such a case. Hope you enjoyed this sharing session, and I'll be glad to follow up with a post-treatment x-rays for this case and to let you know how it went for this patient. Thank you.